did you know that AMENA identities have often been overlooked or misunderstood? Sometimes described as unable to fit into a category. And are there costs or privileges that one must give up once one's identity is named? And what is it like to leave a part of yourself at the door? What if that part is your identity, your heritage, the very thing that makes you you? Welcome to People of Color in Psychology, the show that explores mental health topics specific to culture, diversity, and communities of color. I am your host, Jack Sun. As part of our Arab American Heritage series, we have the distinct pleasure of welcoming Dr. Thorayya Said Giovanelli, a licensed psychologist and holds a doctorate in clinical psychology from Regent University, and has been actively involved in research, including the significant work on dialectical behavior therapy skills group for clients at high risk for suicide attempt. Currently, Dr. Giovanelli serves as a staff psychologist at a large healthcare system, and in that setting, Dr. Giovanelli specializes in delivering empirically based psychological services to individuals and groups who struggle with complex PTSD or chronic pain. Now, as part of her leadership, Dr. Giovanelli serves as the Professional Development Officer and had served as co-chair of the Diversity Inclusion Committee for Mental Health, hence demonstrating her commitment to fostering culturally responsive care and promoting diversity and inclusion within a large healthcare system. Now, for her consultative work, she has served on a hospital-wide DBT consultation team, a suicide post-prevention team, and served multiple years on psychology training committees. Dr. Giovanelli has received awards from the Virginia Academy of Clinical Psychologists and the Department of Psychology at Regent University. As a biracial, Palestinian, and white American psychologist, Dr. Giovanelli will be exploring the impact of therapist identities using the tools created by others and how to include AMENA identities as part of diversity, equity, and inclusion work within a clinical context. Dr. Giovanelli, thank you so much for joining us today.
Thank you. Thank you for that very kind, gracious intro.
I'm really curious about this work that you're doing here. You know, you're talking about incorporating therapist identities as well as DEI work. Before we get into that, why don't you just tell me a little bit more of what you're currently doing clinically?
Certainly. So I probably for the most part operate across my career as a generalist. So I've operated at outpatient clinics where I was the only psychologist. I operate as part of a large mental health team. So I see a large range of presenting problems and concerns. And I think that's partially due to my curiosity. I'm just always curious about what people are, navigating. So at this moment, it could be a range of anything, from adjustment disorder to sleep disorders to, significant trauma histories.
Yeah, so as you're working with these clients, as
Mhm.
many of us do when we're focused on doing clinical work,
Yeah.
oftentimes we miss the part of the therapist's identity. So how
Mhm.
did that start to become the forefront of what you're practicing?
Yeah. That is a good question. I think there was a period of time when I was in my undergraduate work where it I sort of assumed like it was just going to roll into, just being a psychologist, like they plug you in a mold or something. And all of a sudden, like you lose that part of yourself, you leave it at the door. And I know even when I started grad work, there was a few professors who still had that idea of you sort of leave your own identity. Typically, they were, from the majority background, they were heterosexual or they were, white American. So it is the norm. And I started to recognize that that might not be as easy with my name. And this was, in the midst of different stages of the war in Iraq. And anytime something comes up in the Middle East, people are like, that name sounds Arabic. So recognize that whether I wanted to bring it in or not, it was going to come in.
Oh,
So
that is so fascinating. It's
mhm,
like even as you were trained to not acknowledge the identity
mhm,
piece, someone else would bring it in because of your
Yeah.
name. Yeah.
Hmm. Absolutely. And then I think I was really blessed to have some remarkable mentors along the way who taught me how to bring it in an effective way. Like my dissertation chair was amazing in that, if we don't bring it in, if we don't bring up the differences and the similarities, the client's not, because they're going to assume that this isn't something we talk about. And nothing should be off limits to the patient in therapy. If they don't feel safe to bring that up, then something's wrong.
Mm. Mm. So for them to have brought it up, it made you think more critically about the
Hmm.
impact of you doing the work.
Hmm.
So maybe for our listeners, tell us a little bit more about your background.
So I was born in Ohio. So I have a very Arab name in my before I was married, my name was Thorayya Said. So with my middle name, it's very much so in the Arabic culture, you take your father's first name as your middle name. So all of my brothers and I have the same middle name, which is also as a girl, being the only girl in the family, a little bit strange. Like, why do you have a dude's name as your middle name? So again, kids conversation. My mother is very fair. So my mother is American, and my father was Palestinian, who was born in Lebanon. He came here before I was born, and he became a citizen after I was born. So my dad was very dark, and my mom is very fair. So when I was with my dad, people would be like, "Something's different," and then with mom, "Are you babysitting?" So just this
Oh
assumption right off the bat that it wasn't my parents.
gosh. Oh gosh. I
Hmm.
imagine how painful that must have felt for you and your parents especially.
Hmm. Fortunately, I don't recall a lot of those because I think when you're a kid, you're sort of oblivious, like, oh, it's just because I don't, my hair's dark. But then you get older and you're like, oh, that's what that was about.
Oh, yeah.
Yeah.
Mhm.
So I know like what some of my earliest memories as a child is when like different conflicts between Lebanon and Israel, because I still have all of my dad's extended family, his brothers, and his parents at the time, uncles, cousins that live in southern Lebanon, which is, frequently in the news for bombardment and attacks. And I remember my dad being glued to the TV and different times of just not sure if our relatives were safe. This was pre-cell phone. So you had to wait until they got to a landline or send a letter, which could take 2 weeks. So knowing that that was something that other kids my age weren't aware of was like international conflicts wasn't brought up. So kind of knowing right off the bat you're a little bit different. So not just your name, but your normal experiences, your what you eat. And not being fluent in Arabic is like when you're around Arab kids, not realizing like, oh, you don't quite belong there either. So sort of this idea of being on the margins was always kind of a part in the back of my head. And also being Palestinian, if you in the Arab world is often because we don't have a homeland. We are like my family was from what's now northern Israel. So is nowhere that my families can go. So that sort of puts you on the margins in the Arab world even. So just being very aware of that pretty early on. I think that's probably what made me so curious about people in general.
Gosh. So given these experiences you've had, like even feeling at the margins, even within
Hmm.
the Arab community, because of what you
Yeah.
pointed out,
Hmm.
because not having the homeland.
Yeah.
So as you were going through this process early on, and then going through grad school, obviously,
Hmm.
and learning these clinical tools that
Yeah.
we know they're not built. The theorists, we know they're
Hmm.
not Palestinians. We know
Yeah.
they're not, most of them are not based for origin
Hmm.
developed by people of color.
No.
Tell me a little bit more about what that has been like for you as you've evolved in doing this
Hmm.
work.
So I think one of the things it's sort of interesting full circle moment is I've really started to revisit feminist therapy. And that was what my dissertation chair was, her stance was feminist therapy mixed with a little bit of Adlerian. So it's sort of funny to go for full circle in this point in my career. But it did recognize like a lot of the individuation or the CBT. Well, I consider myself a very much a kind of headstrong person. It's often recognized, well, there are going to be people who need that family dynamic who are going to put their needs second. And that's not for me to decide. So that idea of pushing like, oh, you're enmeshed, it felt very judgmental based on my experiences. And I've had therapists of my own who's like, oh, well, your family's problems are not your own. And that was actually the last session I had with that therapist because I'm like, that you didn't even ask me what my values were in this moment. So recognizing that it sort of led me to be more, I don't want to say cautious, but open with where are your values here? What does feels comfortable in your culture, your value system, your beliefs, rather than just kind of imposing, assuming that mine are the norm.
Hmm. Wow, that is important when we're working with our clients
Hmm.
to ask, well, the theories that I'm applying, and of course the person
Hmm.
ourselves that are
Yeah.
actually implementing this, are we imposing certain belief
Hmm.
systems and values onto our clients rather than exploring with them, hey,
Hmm.
what are your beliefs?
Yeah.
What are your values? Yeah.
And that's probably likely why early on I was very connected to the humanistic standpoint. So whether it be existential or just Carl Rogers himself, starting with helping that person grow. So if you want to grow into, being the best stay-at-home mom, that's fantastic. That may not be my goals, but I'm not going to stand in the way of your goals.
Mm, mm. So let's maybe connect this to the AMENA identity. Can you tell us a little bit more about that being a part of diversity, equity, and inclusion work within a clinical context?
Absolutely. And I think it's been an interesting dynamic to watch as far as within DEI work. For the longest time, there was no choice on the census box for Arab American, partially because when people moved here early on, they were often trying to assimilate into other groups or as white. So this has been a lot for, especially since I think probably 9/11, but maybe even before then, recognizing that, this to be white would be to embrace certain privileges that the MENA population doesn't have of, being able to, assume certain things with law enforcement or assume certain, norms within even grocery shopping. So I think within psychology, it's been interesting because it's been pretty novel of how Arab psychology has come out of, and I think that's still kind of in flux. I know in my own world, it's been like my own practice, it would be, I think just creating that space of recognizing that I've been reading the Feminist Killjoy Handbook by Sarah Ahmed. She's a British Australian professor, and she had mentioned that part of being at the table is that you get to take the table for granted
Hmm.
and that you don't pay attention to who's at the table. So the people outside the table who don't have a seat are the ones who are very aware of the process of the table and the seating pattern. And I think that's sort of how I connect my identity with DI work is I being on the outside of the table. I'm very aware of how the table's set.
Because historically, you're saying AMENA populations or AMENA communities weren't
Mhm.
included in DEI
It
work.
it didn't seem like we had a strong voice. And I think there's been people, but I don't know if they've identified themselves as Amina. And this is partially my own ignorance in American culture. But I think that some of it has been because we're not a huge percentage of the population, but there have been, a lot of early adopters. It's just sometimes not always, you know, written through history. So that's just probably my own ignorance as well.
Mm. There's a percentage wise, yeah,
Mm-hmm.
yeah. In professional settings,
Mm-hmm.
yeah, yeah. And it's tricky because there's this blend of, and we've spoken to some Amina guests, and
Mm-hmm.
some describe themselves as white passing. And so
Yeah.
there's a little bit of, I guess, tension. I wouldn't say tension, but just, it's like when people think about DEI work,
Mm-hmm.
it's hard to consider that.
Yeah. Oh, absolutely. I'm glad you brought that up. Is like that idea of either white passing or colorism is that sometimes it's scary because I tend to get mistaken for, either Italian because I'm married to an Italian man or Latina. And I think sometimes coming out and saying I'm Palestinian, it gets a little scary that, will I lose a little bit of that privilege of someone thinking I'm Italian versus Palestinian and having to have that conversation.
Oh gosh. Wow. I'm glad you brought this up. I don't think most, and this is privilege
Hmm. Hmm.
in my statement, most folks don't think about the loss of privilege once they present
Hmm.
in identity, such as say I am Palestinian or
Yeah.
I mean visibly I'm Asian American, but
Mhm.
there's this part where as we're having this conversation, I'm recognizing, gosh, we don't think about
I
loss
think
of that privilege.
yeah, or the perceived privilege that you
Yeah,
may not actually have, but are
yeah.
I think I learned that early on from a really close friend who, when she came out as a lesbian, it was like recognizing that loss of privilege of people assuming she was heterosexual. She never said she was one or the other. Just people assumed that was the norm.
Mm,
So it's just kind of recognizing that sometimes when we are more authentic, we might lose some privileges.
mm, mm. So let's look at this from a clinical context when we're working with our clients in
Mhm,
relation to AMENA identity as
mhm.
part of DEI work within a
Yeah.
clinical context.
I think one of the so thinking about loss of privilege, but actually for me, one thing that has gained privilege is having that AMENA identity. I know for a lot of my African American patients have led them to feel more comfortable talking about their struggles. Of recognize like, oh yeah, you guys have it hard. I've had patients say, and just sort of appreciating the challenges of the Palestinian identity. And I didn't recognize like how often, you know, Black Americans might, be more informed than, not, white Americans on the that sort of matter. Because I know I've had people like, I don't know a lot about what it means to be Palestinian. Or you're the first one I've met who's Palestinian. And I think that can be a little bit heavy as well, as being like, oh, well, now I am the model of this, so better be good.
The pressure is on you.
Yeah,
Yeah, yeah.
exactly.
Mm. And so when we're thinking about these ideas of our own identities, and
Mhm,
especially also if when if or when we encounter
mhm,
Amina clients,
yeah.
are there anything you think would be important for therapists, our listeners, to
Mm,
pay attention to?
yeah. Oh, I mean, definitely some things. I think one is, as with any group, is to avoid assumption. Their Arab world is a very dynamic place, and it's very different from region to region. Not definitely not assuming, religious background because that can vary as well. There's a lot of diversity among the Arab cultures themselves. But I think immigration status is really important. Like, did they come here? Did their parent? Another thing that's unique to the Arab world, but not necessarily just Arabs, kind of in Latino cultures, it's similar, is the language. Like, do you speak the language? And in Arabic is in a very ancient language and something they consider very a point of pride. It's not just language, it's art. Because calligraphy is a big art form in the Middle East. So not knowing the language can feel very humbling as somebody who speaks it very badly. So it can be humbling and sort of a way to break a bridge between yourself and kind of hesitating to meet other Arabs because if you might not speak it.
Mm, mm, yeah. So paying attention to these different facets,
Hmm.
language, immigration status. Did your family immigrate here versus were you
Yeah.
first generation? Yeah, and the language in itself is poetic.
Hmm.
It's a poem. Yeah, yeah, and that also makes me think about the relational piece.
Hmm.
The language is poetic. It's like everything has meaning. So, is there anything else you want to share with our listeners, and in terms of some tips or just some awareness
Hmm.
that we really want to pay attention to?
Yeah.
Yeah.
This, and I think one is, to avoid like in order to avoid overgeneralization, as with any DI work, we want to make sure we're seeing that person and their intersectionality in front of us. Just kind of, how it might intersect their, their gender identity, their sexuality, and knowing that, the family structure may be a little more important beyond just mom and dad and their brothers. It really matters that story, that family legacy. It's not just you.
Mm, mm. So you really build that into as part of your clinical work.
I try to keep it in mind,
Yeah.
especially for people who may come from, non-white identities, is knowing that that may be a relative factor, but it may not be. Like, what is your family story? Do you have a family story? And I think that's something that comes from me because that has kept me strong at times when I needed it, was my family story. So even with all clients, I may ask, like, do you have a family story? How does your family's narrative weave into yours?
I know I don't ask that often enough.
Mm-hmm. Mm-hmm.
Yeah. Thanks for sharing that.
My pleasure.
Yeah.
Yeah.
Yeah. So, in thinking about this work,
Mm-hmm.
and as you mentioned, the motivation and thinking even upon your own family story,
Yeah.
share with us any memorable events and circumstances that influenced how you got into
Mhm.
this clinical work.
Yeah. It's been an interesting journey to psychology, but I knew from the age about 5 or 6 that I was going to be a doctor. Just didn't know what type. So my grandparents came to visit us when I was about, I think, between the age of 5 and 6, and I was just starting first grade kindergarten. And I remember my grandfather, who they had grown up in northern Israel, then Palestine, and my grandfather came from a pretty wealthy family, farmers. Like we had a bunch of land and horses and trees, and his father wanted him to go to school, and he's like, I don't want to go to school, so he just sort of blew it off, and he was unable to read or write. He's like, I've got land. Why do I need to read? And this was the early 1900s, and in 48 he was taken off his land and told that he had 24 hours to leave or face the consequences. And him and my grandmother, who was pregnant, they walked. I don't know how. I've measured it out before, but it was a very long distance to southern Lebanon, where they became refugees until my grandfather passed. And I remember, like, he throughout his life worked multiple jobs to make sure that all three of his kids went to college. He said that's the base of what you need to do. So all of his sons have master's degrees. So my grandfather had 3 sons. And I remember when he came to visit, he was saying, me and my brother were very close in age, about 18 months apart. And he was always like, he's like, and she can be whatever she wants to be. And he looks at one of my worksheets one day and he's asked my mom, what does this mean? She's like, it means that she got all her math problems right. And he looks, I vaguely remember this because my mom was telling me what he was asking her. And he says, come here. So I go over to him and he grabs my chin in his hand and says, maybe this one's going to be the Dr. Said. And I remember thinking in my head, like, well, I guess I'm going to be a doctor now. And from that moment on, I knew whatever it was, I was going to get a doctorate. So for a while, I thought it was going to be an MD. And I recognized I was just more curious about people's stories than just treating of, conditions. So I was like, maybe I should be a literature professor. And then I was like, no, I want to know why people write the stories. So that's how
Hmm,
I got into psychology.
wow. Wow. And so, as a person of color,
Mhm.
what were some challenges that you faced and overcame that you would be willing to share?
I think I've been really fortunate to have a lot of really supportive people around me and a lot of really strong female role models. I think the scariest thing has been like after 9/11 was just it was exhausting when people be like, why? Why do Arabs hate us? And I'm like, I don't hate you. And having explained Arab history and like these tidbits, and I'm like, and I remember being, pretty young, but thinking, I don't think this is normal that people are asking me these questions. And as I got older and looked back, I was like, that's not my responsibility.
How old were you when they were asking this?
I was like, I think 19.
Oh gosh.
And I remember thinking, because I was working my first job, and I remember one of the managers, and he was a nice guy, but he was like, why did this happen? And I'm thinking, I don't have the time to tell you. I mean, this is very complicated, and I don't know everything, but I know a brief Cliff Notes version. And thinking, like, why are you asking me? Why am I
Yeah.
having to speak for this?
Yes. Oh
Mhm.
gosh. How did you overcome the barrage
Mhm.
of interrogations essentially?
I think some of that was just sort of seeing, like, in a way, not knowing what I was doing then, but reframing it as an opportunity. It was like,
Hmm.
if they don't ask me, where are they going to get the data? And maybe I could direct them to a reputable resource, or I can at least say, hey, there's this person I like who is Arab American, who is Palestinian. Maybe they're not so scary. So I think it was just even at that young age, knowing just if we reframe something, it makes it more bearable.
Hmm.
And now I
So
correct people. I'm
yeah.
like, I'm happy to talk with you, and I'm not an expert on this. I'm a psychologist.
Yes, yes. I just can't fathom that. 19, you're already
Mhm,
in some ways managing impression
mhm.
management of other people
Yeah.
by saying, "Wait, I don't hate you."
Mhm.
Right. To say that.
Yeah.
Yeah. Oh gosh.
Mhm,
Oh. Now, for you, what does it mean to be a biracial Palestinian and white American
mhm.
psychologist?
I think it means a lot of privileges that I try not to take for granted. For example, one of the things I think that keeps me very grounded is that I know that some of my relatives or some of my, people, other women in my situation who, are Palestinian, don't have the access to college, or because they don't have homes, because they live in, what's going on in Gaza, or they may not have the financial means to go to college. I remember my dad's first memory was they were sleeping in a tent at the time because they didn't have housing, and knowing that I've never had that experience. So that to me means that I have a privilege that I hope I never forget. The other side, it also reminds me that there are a lot of structures in place that are designed for some people and not for others. And I try to remember that I may run into them, and my job is to, if I can get over them, make sure someone gets in behind me.
Yeah. Hence the work, the DEI
Hmm.
work that you've
Yeah.
continuously been a part of.
Hmm.
Yeah. Yeah. And so, Thorayya, how can we support you?
I think for everyone to speak up and just as best we can. I mean, we obviously, we're all one, but together with, we're more than one. I think just recognizing that no civilians or children should have to die just for I don't know what. I mean, I'm not obviously the what's going on nationally is, I mean, internationally is beyond my scope. I'm a psychologist, but I can't fathom being okay with tens of thousands of civilians and children dying. So I think just when I've heard people just even asking other Arabs or Palestinians, like, "Are you okay?" It really goes a long way because we all sort of have this band around our heart, like other Palestinians I know, that I'm just like, they're like, "Stay strong, be well," and you can just see it in their eyes. And it's like, it's just nice to be seen.
Yeah. Yeah. Well, you are seen. This is why we are recording this.
Mhm.
Any final thoughts?
No, I appreciate you doing this. I think, like you said at the very beginning, is we take for granted that most of the tools we've used are very helpful and not tailored or studied on people, all types of people. And hopefully we can all continue to make sure the tools are applied in a way that helps everyone. So I appreciate you saying that, and I appreciate you having this discussion to bring other folks out.
Yeah. Yeah. Well, you bet. Thank you so much for your
Thank you so
time.
much.
A huge thank you to our listeners. If you enjoyed this episode, please share and subscribe to People of Color in Psychology. You can also support us by registering for continuing education courses or making a one-time donation on the Multicultural Counseling Institute's website. Your feedback is important to us, so feel free to send an email, a message on LinkedIn, or leave a voice message on our website. Until next time, this is your host, Jack Sun.